I'm Dr. Mike Billigan. I'm here with Dr. Tom Neighbors of OralDNA Labs from Brentwood, Tennessee. Tom, thanks so much for being with us.
Thank you, Mike. It is a pleasure for me to be here.
Great. This is really interesting, and it's new, and it's something that really is coming into our dental practice. We are here at the Hinman Dental Meeting, so there's some background noise, but you really need to hear this. Tell us a little bit. Now, you started about 4 years ago with this, but then created this company about 2 years ago, OralDNA Labs. Tell us about OralDNA Labs, Tom.
Absolutely. Thank you very much, Mike, for the opportunity to speak to you and also to speak to your audience. I had the privilege of being a general dentist for about 38 years, and during that process, there were some things that bothered me, and that is how we were diagnosing. And my question was, could we be better in the diagnostic arena? And became very interested. I can remember the moment in 1983 reading a JADA article, and ended up at NIH and to observe some of the things they were doing there. And it really set I call it my avocation around microbiology and immunology and genetics. I said those must be the keys to us understanding disease.
Right.
And so as I followed the evolution of our understanding the mouth and the events that occur in the mouth around particularly periodontal disease, we soon discovered through the work of oral microbiologists that while the mouth has maybe as many as 700 species of microorganisms that are there, not all of them really produce bad disease. Some of them create inflammation and bleeding, but we've all seen those patients where they have heavy calculus and bleeding, but they don't necessarily lose a lot of bone.
Right.
But then you see those individuals who brush and floss every day, and for some reason or another, they just never get well.
Right.
And we talk about brushing and flossing, and we think it's all mechanical.
Well, there are other factors. There's the mechanical, there's there's nutrition, there's a number of factors.
Absolutely right.
But this is huge. So
it is. So I began using in my practice molecular diagnostics that were pre-DNA, and I learned in the late 90s that in Europe they were actually using some early DNA models because we had learned by that time that there were some specific microorganisms in the mouth that were true pathogenic microorganisms. Just as TB is a pathogenic microorganism, and just as other infectious disease have true causative agents, the microbiologists, because of the new technology around polymerase chain reaction, gave us the ability in dentistry to look at oral infections just like any other infectious disease.
Okay, so we can actually tell the microorganism that's causing the problem and see if they've got it through this technology.
Absolutely right.
Tell us about that.
And so what we learned was that there are relatively few species in the mouth that occur in the biofilm communities that are truly virulent and pathogenic. And these microorganisms create a challenge to the immune system. And thus we see in these individuals an immune response that eventually leads to attachment loss and ultimately ends up in what we call pocket depths or bone loss. Actually what it is a bone infection. We end up with bone infections as a result of these bad bugs.
Right, and there's only a few of them, and we're able to, through a diagnostic test.
Absolutely right.
Okay.
And so what we learned was that these microorganisms that we see on this report here are the ones that are most associated with this clinical inflammatory response. And thus, when we see individuals, even in the earliest states of redness and bleeding, that doesn't go away, then we can diagnose from a biological component as opposed to just looking at clinical signs. And so now, just as we get blood work done in our physician's office to look for risk, and that's the reason we have blood work, is for diagnosis and prognosis, and to determine if we are at risk, even prior to the exemplification of a disease state. If we're at risk for cancer, we want to know. And so if we are at risk for cardiovascular disease, we want to know. And that's what these tests do for dentistry, for dentists and hygienists.
Especially with the oral systemic link and
Absolutely.
Now we need to know what pathogens we have here that might be moving through the entire body.
Absolutely right.
I would think as we're able to learn this, we can share the results of these tests with our medical community.
Absolutely.
Maybe really help our patients in that way, as well as generate many referrals to our practice from these physicians as they learn that we are providing the service. Would you say that's what you're saying?
Absolutely what it is. And I think there are three very, very hot topics in medicine today. Number one is the topic of inflammation.
Yes.
We know that inflammation today may be the cause of all disease forms, including cancer. So inflammation is important, and also inflammatory burden is important. So as dentists, now we can measure the potential implication of the inflammation in the mouth based on the inflammatory burden that we see from these reports. So as you're stating there, we can predict who is going to have more severe disease, we can target the specific causative agents, and we can have better treatment outcomes because we'll treat high-risk patients differently than we treat low-risk patients. Another very, very important area that's hot topic is the subject of wellness and health. So people really want to know, how can I remain healthier? How can I prevent illness? And so we talk about exercise, nutrition, and diet, and all of that. And yet we now know that there is a relationship between inflammation and all of its sources to the loss of health and wellness.
Right.
And so now we can play a major contributing factor in helping prevent people from getting sicker by treating their mouths and using these reports. And one final thing that I want to say about that is another really, really hot topic in dentistry today is salivary diagnostics. Because we tend to see saliva now very differently than you and I saw it when we graduated from dental school. Well, now we know in saliva that there are certain analytes, or in other words, certain areas that have great potential for providing information. And DNA is one of those sources. So our company, OralDNA Labs, formed a company about 2 years ago where we created a laboratory, provide clinical lab reporting using these three models: health and wellness, the inflammation, and then using this technology around DNA PCR. So we can provide a pathogen report that tells individuals a very unique aspect. And we talked about risk assessment and risk management.
Right.
And as we said earlier today, and I remember a statement in 1994, it's been that long ago, 16 years ago, and one of the pioneers in oral microbiology made the statement that the most significant risk indicator for any disease is the causative agent of that disease. Right. And so while we know that smoking and diabetes and genetics and all of those are risk factors,
it's the causative agent.
Causative agents.
Primary. And so, that's what we're...
Absolutely.
And we're going to shoot a few videos. They've got 3 different tests with OralDNA Labs, and we're going to shoot a separate video on each of those 3 tests and show you what each of those is, what they do, and that. The cost of these tests would be...
it costs $99 to the clinician.
To the clinician, okay.
Right, and clinicians are charging $125 to $175.
Okay.
There's a collection, all of the codes are there. There's a collection code, and also there are...
So some of the insurance companies are picking this up?
Some of the insurance companies picking up very well, yes.
Okay, very well.
Yeah.
And this is growing. You've got more and more dentists coming on board with this?
We absolutely do. We have hundreds of dentists.
Yeah,
we will have
quickly.
Thousands, yeah.
Growing very quickly.
Absolutely.
So let's take a look at this, and then we're going to go ahead next and shoot some other videos on each of the different tests that they have.
Good.
It's very interesting.